Hey Alpha Nurses, I'm Nurse Sandro from alphanursguide.com. This is NCLEX PN Review Lesson 25. We're going to be doing respiratory care procedure questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. A client is being prepared for a thoracentesis. The nurse should assist the client to which position for the procedure? A. Sims position, with the head of the bed flat. B. Prone, with the head turned to the side, supported by a pillow. C. Lying in bed on the affected side, with the head of the bed elevated 45 degrees. D. Lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. The correct answer is D. Lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. Rationale: to facilitate the removal of fluid from the chest, the client is positioned sitting on the edge of the bed, leaning over a bedside table, with the feet supported on a stool, or lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. Question 2. The nurse is providing endotracheal suctioning to a client, who is mechanically ventilated, when the client becomes restless and tachycardic. Which action should the nurse take? A. Notify the rapid response team. B. Finish the suctioning as quickly as possible. C. Contact the respiratory department to suction the client. D. Discontinue suctioning until the client is stabilized and monitor vital signs. The correct answer is D. Discontinue suctioning until the client is stabilized and monitor vital signs. Rationale: if a client becomes cyanotic, or restless, or develops tachycardia, bradycardia, or another abnormal heart rhythm, the nurse must discontinue suctioning until the client is stabilized. It is also important to monitor the vital signs and the pulse oximetry. If the client's condition continues to deteriorate, then the respiratory department and healthcare provider may need to be notified. There is no data in the question that indicates that the rapid response team needs to be notified. Question 3. The nurse is assisting with monitoring the functioning of a chest tube drainage system in a client who just returned from the recovery room after a thoracotomy with wedge resection. Which findings should the nurse expect to note? Select all that apply. A. Excessive bubbling in the water seal chamber. B. Vigorous bubbling in the suction control chamber. C. 50 milliliters of drainage in the drainage collection chamber. D. The drainage system is maintained below the client's chest. E. An occlusive dressing is in place over the chest tube insertion site. F. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. The correct answers are C. 50 milliliters of drainage in the drainage collection chamber. D. The drainage system is maintained below the client's chest. E. An occlusive dressing is in place over the chest tube insertion site. And F. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. Rationale: the bubbling of water in the water seal chamber indicates air drainage from the client. This is usually seen when intrathoracic pressure is greater than atmospheric pressure, and it may occur during exhalation, coughing, or sneezing. Excessive bubbling in the water seal chamber may indicate an air leak, which is an unexpected finding. The fluctuation of water in the tube in the water seal chamber during inhalation and exhalation is expected. An absence of fluctuation may indicate that the chest tube is obstructed, the lung has re-expanded, or no more air is leaking into the pleural space. Rationale continued: gentle bubbling should be noted in the suction control chamber. A total of 50 milliliters of drainage is not excessive in a client returning to the nursing unit from the recovery room. However, drainage of more than 70 to 100 milliliters per hour is considered excessive and requires healthcare provider notification. The chest tube insertion site is covered with an occlusive dressing to prevent air from entering the pleural space. Positioning the drainage system below the client's chest allows gravity to drain the pleural space. Question 4. The nurse is assigned to assist the healthcare provider with the removal of a chest tube. The nurse should reinforce instructing the client to do which during this process. A. Stay very still. B. Exhale forcefully. C. Inhale and exhale quickly. D. Perform Valsalva's maneuver. The correct answer is D. Perform Valsalva's maneuver. Rationale: when the chest tube is removed, the client is asked to perform Valsalva's maneuver, the tube is quickly withdrawn, and an airtight dressing is taped in place. An alternative instruction is to ask the client to take a deep breath and hold the breath while the tube is removed. Question 5. The nurse is assisting in planning care for a client with a chest tube. The nurse should suggest to include which interventions in the plan. Select all that apply. A. Pin the tubing to the bed linens. B. Be sure all connections remain airtight. C. Be sure all connections are taped and secure. D. Empty the drainage from the drainage collection chamber daily. E. Monitor closely for tubing that is kinked or obstructed by the weight of the client. The correct answers are B. Be sure all connections remain airtight. C. Be sure all connections are taped and secure. And E. Monitor closely for tubing that is kinked or obstructed by the weight of the client. Rationale: chest tube tubing is never pinned to the bed linens, because this presents the risk of accidental dislodgment of the tube when the client moves. The chest tube system is not opened and emptied because a closed system must be maintained. If the system is opened, lung collapse can occur. Question 6. The nurse is assigned to assist with caring for a client who has a chest tube. The nurse notes fluctuations of the fluid level in the water seal chamber. Based on this observation, which action would be appropriate? A. Empty the drainage. B. Encourage the client to deep breathe. C. Continue to monitor, because this is an expected finding. D. Encourage the client to hold his or her breath periodically. The correct answer is C. Continue to monitor, because this is an expected finding. Rationale: the presence of fluctuations in the fluid level in the water seal chamber indicates a patent drainage system. With normal breathing, the water level rises with inspiration and falls with expiration. The apparatus and all connections must remain airtight at all times, and the drainage is never emptied because of the risk of disruption in the closed system, which can result in lung collapse. Encouraging the client to deep breathe is unrelated to this observation. The client is not told to hold his or her breath. Question 7. The nurse is assigned to care for a client who has a chest tube. The nurse is told to monitor the client for crepitus. Which method should be used to monitor the client for crepitus? A. Asking the client about pain. B. Checking the respirations hourly. C. Checking the blood pressure every 2 hours. D. Palpating for the leakage of air into the subcutaneous tissues. The correct answer is D. Palpating for the leakage of air into the subcutaneous tissues. Rationale: subcutaneous emphysema is also known as crepitus. It presents as a puffed-up appearance that is caused by the leakage of air into the subcutaneous tissues. It is monitored by palpating, and it feels like bubble wrap when palpated. Although options 1, 2, and 3 may be components of the plan of care for a client with a chest tube, these actions will not identify subcutaneous emphysema. Question 8. The nurse is told that an assigned client will have a fenestrated tracheostomy tube inserted. The nurse should provide the client with which information about this type of tube? A. Enables the client to speak. B. Checking the respirations hourly. C. Prevents the client from speaking. D. Prevents air from being inhaled through the tracheostomy opening. The correct answer is A. Enables the client to speak. Rationale: a fenestrated tube has a small opening in the outer cannula that allows some air to escape through the larynx. This type of tube enables the client to speak. Question 9. The nurse is reinforcing instructions to a hospitalized client with a diagnosis of emphysema about positions that will enhance the effectiveness of breathing during dyspneic episodes. Which position should the nurse instruct the client to assume? A. Side lying in bed. B. Sitting in a recliner chair. C. Sitting up in bed at a 90-degree angle. D. Sitting on the side of the bed, leaning on an overbed table. The correct answer is D. Sitting on the side of the bed, leaning on an overbed table. Rationale: positions that will assist the client with breathing include sitting up and leaning on an overbed table, sitting up and resting with the elbows on the knees, or standing or leaning against the wall. Question 10. The nurse is gathering data on a client with a diagnosis of tuberculosis. The nurse should review the results of which diagnostic test to confirm this diagnosis? A. Chest X-ray. B. Bronchoscopy. C. Sputum culture. D. Tuberculin skin test. The correct answer is C. Sputum culture. Rationale: a definitive diagnosis of TB is confirmed through culture and isolation of Mycobacterium tuberculosis. A presumptive diagnosis is made on the basis of a tuberculin skin test, a sputum smear that is positive for acid-fast bacteria, a chest X-ray, and histologic evidence of granulomatous disease on biopsy.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.